Hi, I'm Michael, and we are Inoviv. If you get cancer, there may be a drug that can cure you. The problem is, you may never know about it. In fact, 75% of the time, cancer drugs do not work. And this isn't the fault of your doctor. It's actually because there's no easy way of knowing which drug to use on which type of cancer. Clearly, this is a serious problem for patients. It's also a problem for pharmaceutical companies because they can't find all the patients who could get their drugs. So they lose over $100 billion a year in sales. At Inoviv, we develop new blood tests to go with new drugs. We can test a blood sample and tell a pharmaceutical company if their drug will work for a patient. And this isn't just for cancer. It's for many diseases where this was never possible before. This sounds simple, right? This is only possible because of my co-founder, Ernestus, who's one of the world's leading researchers in this field. He's developing a unique technology that means we can detect types of disease where others cannot. Ernestus has 13 publications in this field and has brought 5 biomolecular tests to market. He has a first-class master's in molecular biology from the University of Bath and has spent his career at Pfizer and University College London. Ernestus dropped his PhD to build this company. The secret here is targeted proteomics. You may have heard of genomics. While genomics tells you what's hard-coded, targeted proteomics goes much further. It tells you what's happening in the body right now. We can detect hundreds of molecules in the blood at a fraction of the cost of other technologies. This means we can understand the unique molecular signature of each person's disease. And we can use this to match them with the right drug. We've already built functional prototypes of our core technology and our first test, which we'll protect with trade secrets and patents. Right now, we're developing drug matching tests for 3 pharmaceutical companies who are sending us blood samples. Each sample we test is worth thousands, and altogether, our market size is $14 billion. We're purely an enabling technology, so we're not regulated, and we don't need to be. We're not a hardware company, and we don't plan to be one. We're actually ready to start selling tests within 6 months. Of course, this is only possible with a unique team. I mentioned my co-founder, Ernestus. I've spent the past 5 years working with top pharmaceutical and healthcare organizations, where I delivered technology projects and helped secure multi-million-dollar deals. I also worked on 2 biotech startups before Inoviv. We're supported by a phenomenal advisory board, including a proteomics expert, leading clinical academics, and a commercial advisor. But most importantly, we've put our blood, sweat, and tears into this. And I mean that. We literally used our own blood samples to test our technology. To realize the vision of a world where personalized medicine is the norm, we need an enabling technology to make sure every patient gets the right drug. We are that enabling technology. We'll be raising in a few months' time, and we'd love to speak to anyone who might be interested. Come and talk to us. Thanks.